If you often wake up with a dry mouth after 60, it can be easy to brush it off. Maybe you blame the weather, maybe a fan running in the bedroom, or simply sleeping with your mouth open. And sometimes, those things do play a role. But when dry mouth keeps happening night after night, becoming more noticeable, or starting to affect your comfort and sleep, it may be worth paying closer attention. The good news is that dry mouth is usually not a medical emergency. Even so, when it is persistent, worsening, or happening alongside other symptoms, it may be a signal worth discussing with your doctor or dentist. Before we continue, a quick but important note. This video is for educational purposes only. It is not medical advice. It does not diagnose, treat, or replace professional medical care. If your symptoms are new, sudden, severe, or getting worse, please speak with a qualified healthcare professional. And never stop, start, or change any medication without first consulting your doctor. Many older adults assume that dry mouth is simply a normal part of aging. While age-related changes can sometimes play a role, that explanation is not always the full picture. Dry mouth, sometimes called xerostomia, happens when there is not enough saliva to keep the mouth comfortably moist. Saliva does more than most people realize. It helps protect the teeth and gums, supports swallowing, contributes to taste, and keeps the mouth comfortable throughout the day. When saliva levels drop, the risk of problems like tooth decay, gum disease, mouth sores, oral infections, bad breath, and difficulty swallowing may increase. That is why persistent dry mouth should not automatically be dismissed as just a part of getting older. So what might be causing it? One common possibility is medication side effects. Many older adults take medications to manage various health conditions. Some of those medications have been associated with reduced saliva in certain individuals, including medicines used for blood pressure, depression, bladder control, allergies, and colds. This does not mean medication is always the cause. And it does not mean anyone should stop taking a prescribed medicine. But if your symptoms begin after a medication change or have gradually become more noticeable over time, that is something worth raising with your doctor or pharmacist. Another possible cause is mouth breathing, snoring, or nasal congestion. When the mouth stays open during sleep, the tissues inside can dry out over several hours. Some people notice this more when allergies are active, when the nose feels blocked, or when snoring becomes more frequent. This does not mean everyone who wakes up with dry mouth has a sleep disorder. Mouth breathing during sleep is simply one possible explanation. A related possibility is obstructive sleep apnea. Some people with this condition wake up with a dry mouth, along with other signs such as loud snoring, morning headaches, waking up gasping, or feeling excessively sleepy during the day. However, dry mouth on its own does not diagnose sleep apnea. It is one possible clue among many. Proper evaluation requires a sleep study and guidance from a qualified healthcare professional. Another factor to consider is hydration. When the body does not have enough fluid, saliva production can decrease and nighttime dry mouth may become more noticeable. As we get older, the sensation of thirst tends to become less reliable. This means some people may not realize they are not drinking enough throughout the day. That said, fluid needs vary from person to person. Some individuals have medical conditions that require specific guidance around how much they drink. Personal recommendations should always come from a healthcare professional who knows your full situation. Dry mouth can also appear alongside blood sugar concerns. Since type 2 diabetes becomes more common with age, it is worth mentioning that elevated blood sugar levels have been associated with dry mouth in some individuals. That does not mean dry mouth is proof of diabetes. Many different factors can cause this symptom, but if it is persistent, it is one reason to bring it up with your doctor. One more possibility involves certain conditions that affect the body's ability to produce moisture. Some people experience both dry mouth and dry eyes together. When symptoms persist or occur in combination, a healthcare professional can help determine whether further evaluation is appropriate. The important thing is not one isolated episode. The important thing is the pattern. Waking up with a dry mouth once in a while is very different from experiencing it every night for weeks or months. Take note of whether the symptom is new, whether it is gradually getting worse, whether it happens every night or only occasionally. It can also be helpful to notice if dry mouth occurs alongside other signs such as snoring, waking up gasping, morning headaches, excessive daytime sleepiness, unusual thirst, dry eyes, mouth sores, bad breath, frequent cavities, trouble swallowing, changes in taste, or cracked lips. You might also take note of recent medication changes, alcohol or caffeine intake, nasal congestion, whether you use a SPAP machine, or whether the symptom seems to improve when the bedroom air is more humid. This is not about diagnosing yourself. It is about gathering useful information that can support a more productive conversation with your healthcare team. So what are some general habits that may help support oral comfort and health? Many people benefit from staying well hydrated throughout the day based on their doctor's guidance. Consistent brushing and flossing can help protect the teeth and gums. Regular dental visits are also important, especially if dry mouth is becoming a frequent concern. Limiting tobacco use and excessive alcohol may also benefit overall oral health and comfort. Some people find that using a room humidifier at night makes a difference. Others benefit from discussing nasal congestion with a healthcare professional and exploring appropriate options. Sugar-free gum or sugar-free lozenges may help stimulate saliva production for some individuals. And if you suspect a medication could be contributing, ask your pharmacist or doctor whether dry mouth is a known side effect. The goal is to ask informed questions, not to make medication changes on your own. Now, let us talk about situations that require prompt medical attention. Seek urgent medical care if dry mouth occurs together with any of the following: chest pain, shortness of breath, fainting, sudden confusion, weakness on one side of the body, sudden changes in vision, a severe headache, signs of severe dehydration, inability to swallow, swelling of the face or tongue, high fever, or any symptoms that could suggest a medical emergency, including stroke or heart attack. You should also contact a doctor or dentist if dry mouth is persistent, getting worse, causing mouth sores, frequent cavities, oral thrush, difficulty eating or speaking, or is affecting your quality of life. After 60, paying attention early is usually more helpful than waiting. When speaking with your healthcare team, you may want to ask whether any of your current medications could be contributing, whether your dental health needs closer monitoring, whether mouth breathing or snoring may be involved, whether blood sugar testing is appropriate for you, or whether symptoms like dry eyes should be evaluated further. You can also ask about saliva substitutes or oral care products that may be suitable for your situation. And if you have heart or kidney conditions, ask whether your daily fluid intake should be reviewed. Most importantly, remember this: nighttime dry mouth is a symptom, not a diagnosis. Sometimes the explanation is simple. Sometimes it is a signal that a conversation with your doctor is worthwhile. The goal is not to worry. The goal is to be informed. If this has been happening to you, there is no need to panic. But if the symptom is ongoing, worsening, or affecting your daily life, bring it up with a qualified healthcare professional. Listen to what your body may be telling you. If this video helped you understand your body a little better, consider subscribing to After 60 Health Signals for calm, practical explanations of the health signals that matter after 60. And if your symptoms are new, persistent, severe, sudden, or getting worse, please speak with a healthcare professional. Thank you for watching, and take good care of yourself.